ladies and gentlemen, allow me to welcome Dr. Githinji Gitahi to tell us more on health systems management. He's going to be talking about options available in medicine outside clinical work, and also how to identify these options in keeping with one's strengths, also thinking out of the box, and how to market oneself and advance in the career of choice. So welcome very much, Dr. Githinji. Please take it up from there.
Well, thank you very much, Ngina, and I hope you can hear me.
Yes, we can. You're audible.
All right, thank you very much. Thanks, Ngina, for that very generous introduction. And Diana, thank you for inviting me. It's been difficult finding a slot, but here we are. And for all those colleagues who've joined, good morning. And if you're not in Kenya, good afternoon, good evening, wherever you may be. This is a very difficult conversation and very difficult topic to navigate, and it's best navigated face to face. So I wish we had a chance to sit together and talk and interact, because it's a very personal journey. It's not something that you can answer in a formula. It's not something you can answer in a single statement. Navigating careers, understanding the ecosystem in a complex area like health is also a very individual journey. It's a journey that depends on your passions. It's a journey that depends on what you're curious about, and the journey that depends on your personal courage and all those things that come as you create, a career. So many of you. So all of you are very successful in your careers, and you're working in particular areas because of your interests. My understanding is that, and all the people here are in one stage or another of their obstetrics and gynecology career. And correct me if I'm wrong, Gina. So that's my understanding. And each one of you has navigated this either as a clinician, as a researcher, as somebody who probably already working in an area of advocacy or working in an area of management. You may have, also advanced in particular areas. Maybe you've decided to focus on oncology, or you've decided to focus on, whatever areas that you have. So all of you are extremely successful in the area you are in. So again, therefore, it cannot be a conversation around how to find a better job. I don't think so, because all of you are respected professionals wherever you are. So I'll approach it with that humility, knowing that I'm talking to people who are already established in their careers. And therefore, I will approach it more from what problem do you want to solve, rather than what career do you want, because you already have a career. The first thing, therefore, I would like to ask us to do is to just look at this. I've created this slide. Gina, can you see the slide that I've shared? I hope you can.
Yes, we can.
Okay, good. So what I'm going to do is ask us to just get into this code and answer just one question. And let me see whether I can move this forward. In terms of asking the working for health and what problems we think that we need to solve or are being solved. Let me see whether this moves. Yes, there we are. So if you could just go to this website, menti.com, and use that code. And I could probably just go back to here because there's a code if you want to scan. But just enter that code, or just go directly to menti.com and enter that code. I see two people have joined. So let me see if you can join that. I just want to understand, or to have a common understanding about what challenges we see as being the largest in health. Please join. Once you join, I'll go to the question. I'll go to the slide with a question. For now, just join. maybe as we join, because it's the same, you can still go to that and get the code and go in. So I don't have to keep on that slide. I just want to see what we think are the main problems. So in your view, what are Africa's greatest health challenges today? Because I think the question then you'd ask is, as a career professional in the health sector, what problem would you want to solve? Are you solving that problem right now? And what are the pathways to solving that problem? Because then if you're looking to just make impact, then you follow that path. If you're looking to change your career, then you follow the path that you feel you can make biggest impact. If you're feeling you want to understand further how these challenges are solved, then you start from there. So that's why I want us to just very quickly answer that question. What are Africa's greatest health challenges today? And I see them coming up. So we are now at about 10 responses. So if you can answer those, please do, if you can answer this question. So maybe another 2 more minutes in case there is anyone trying to get into the system. Okay, let's look at what we have. We have 17 responses. Well, 21 now, so they keep going. But as you can see, the keyword here is access, and the second keyword is quality. And that's in terms of the words that are the center through this word cloud. But there are many other challenges that have been highlighted. Prevention of illness, lack of hospital resources, poverty, maternal mortality, lack of modern resources, staff affordability, health financing, delay in accessing care. And this actually explains to you that the challenges in the health sector are not lack of science, they're not lack of skills, they're actually beyond the individual skills. I thought talking to a group of obstetrician gynecologists, there will be more specific challenges, but it's actually true that whatever profession you talk to, whether it's surgery, Obsgyn, you talk to pediatricians, you talk to epidemiologists, the challenges will be ecosystem challenges. They will not be challenges that are specific to a particular disease, because those science has told us exactly what to do. And even where we are not sure, there is research going on. But there is always solutions which are specific and individual, but at ecosystem level is where the major challenges are. So it's not surprising to see that access and quality are actually the key challenges. And therefore, the question that we tend to ask ourselves, or we would ask ourselves in finding what opportunities exist in the area of healthcare or medicine, as was stated in the little poster, if the challenges are quality, access, prevention, motivation. I see maternal mortality is probably the only directly related issue directly related to a particular vertical area, maternal mortality, which can be defined. Everything else here is resources, is poverty, it's financing, it is human resource mix, it's health finance system and government failure. So it tells us that actually then, even if you look at the career choices and you look at the areas of work of impact, they extend beyond the work that you do day to day, seeing the patients or advising your patients. They exist beyond the day-to-day work in theater. They exist beyond the day-to-day work in the hospital. then the question is, how do you then navigate this difficult ecosystem to say, rather than resolve only the patients I have today, what can be my role within this larger ecosystem, and who is it I would work with within this larger ecosystem, and is this an area of passion for me within this larger ecosystem, and how do I navigate solving this larger ecosystem? I think that kind of summarizes the conversation, and therefore looks beyond and saying, should doctors focus on the daily clinical challenges of their patients that they navigate within these challenges that you listed here, or should doctors also take an interest in resolving these larger challenges, and how? I think that is really what I would like us to talk about very quickly. But I think, as I said, because there's not a unidirectional conversation, I would just like to highlight a few things, and then we can move forward and ask ourselves a few questions, and maybe a few comments from you, comments and questions, because as I said, I'm not going to be a lone advisor on this. It's something that we really need to converse on. But thank you for that exercise. Let me share a few other slides, if I can, on just a way to probably think about this. So just as you've highlighted, Africa is a continent other than Asia, which is largely, India specifically. There are many other countries in Asia that have similar problems. Africa is a continent where we are now, is a continent that is challenged with the lowest access to health services. All the issues you've highlighted are actually front and center of these challenges. If you look at the lightness of the color that is indicated here, you will see that Africa and India are the geographies that have the grayest of colors, and basically meaning the lower the color, the lower the percentage of the population that has health coverage. And in Africa, many countries are below 20% of the population having health coverage. Health coverage here means population that is able to access a defined set of what you may call tracer indicators that say that this population has access to health coverage. Those tracer indicators are defined by WHO as a set of indicators around maternal and child health, a set of indicators around infectious diseases, and they have picked a few, about 4 in each of these areas, a set of indicators around non-communicable diseases, and a set of indicators around service infrastructure, mix of healthcare, service, human resources for health, which we like to prefer to health workers, because then human resources for health includes not only the specialists, the doctor, the nurse, and the midwife, and the lab technologies, but includes the records clerk, includes the watchman who serves the hospital, the cleaners, the people who handle waste disposal. All those form the the human resources for health, because as you know, working in your area, operating in the theater without somebody who cleans the theater and makes sure the bed is maintained will not enable your work. So those people who are biomedical engineers, those people who clean, those people who push the trolley and push your patient are health workforce. They are actual human resources for health. So, and then number of beds, number of ICU beds, number of laboratories. So the WHO puts together this composite index, which is called the Service Coverage Index, which is made up of 16 proxy indicators or tracer indicators in these blocks: maternal and child health, non-communicable diseases, infectious diseases, and service delivery. So once you look at those and you create a composite index, then you can see that based on those tracer indicators, Africa has the lowest people who have access to those. And Africa for now, if you put all the countries together, because a country like Kenya is just a little more advanced than most of the others in Central Africa and West Africa. In North Africa, you can see there is a little more blue, which is more towards Europe or North America. South Africa again, so but Sub-Saharan Africa. But when you put the aggregate together for the continent, you end up at about 44% of people who have access to health coverage, percentage of people with access to health coverage. That means that almost 60% of our people do not have access. So the challenges you raised are critical, meaning that even if you have the best Obsgyn available, 60% of people would not have access to that person. But maybe when you talk about specialization, that percentage will go on almost up to 95%. But on average, because people are able to access community health workers, midwives, and nurses, then when you average, you end up with this 44%. So the question then is, how do we move on from there? And what is the issue? This is an issue, an ecosystem issue. It's an issue of health systems. So again, WHO and others define. So what is it you would say if you want to have proper health system that is accessible? What is it you need to build it in terms of the building blocks? And of course, many of you will be aware of the health system building blocks. They are defined as 6 of them, but they must be accessible, meaning that they must be accessible to everybody in an equitable manner, in a quality way, and safely. Those are the 4 things in the middle, but those are service delivery, meaning where do people access the services? Is it in a roadshow? Is it in an outreach? Is it in a level 3, level 2? Is it in a mobile van? Is it, service delivery? Service delivery is where the people receive the service. And this service doesn't have to be received in your clinic, can be received in a hospital, can be received in the village, can be received anywhere across. Number 2 is the health workforce, the people delivering the service. Who are these? These are the trained health workforce. We know Africa has a huge gap of health workforce. So we are aware that we probably, the data available now says we need 16 million more health workers. And the question is, why don't we have them? Or, people who work, or human resources for health. Then after that is the information you need. The information you need to decide how to reduce maternal mortality, how to reduce child mortality, how to reduce pneumonia in children, how to reduce diarrhea in children. What is going on? What are the areas in your country that have diarrhea? Why? Is it because there's a breakdown in water? Are those also the same areas that have the lowest access to water and sanitation? Where are the women coming from? Why is it Mandera and other places have such high maternal mortality? It's not because there are no trained gynecologists in the country and obstetricians. It is probably, even if there are obstetricians, the ecosystem issues you talked about. One of the biggest challenges when we ask patients, why didn't you access care? They say it's transport. How do you solve transport as an Obsgyn? How do you solve the transport problem of a mother who couldn't find transport to come and find you? How do you solve social norms and patriarchy, where men have to give permission to the women who are pregnant to go to the clinic, and they have to wait for their husbands who are out in the pasture to come and say, yes, you can actually allow you to go. And you can't go alone, you have to be accompanied. How do you solve that as an Obsgyn? How do you solve the issue of health financing, where the government doesn't give adequate money to the health system, or the government doesn't have adequate money to give to the health system? And therefore, how does the little money that is there get prioritized? How does it get prioritized to maternal health instead of cancer? Who makes those decisions? And where are you when those decisions are being made? And where is the information that's available to make these decisions? And is the information comparable? Or is it only within your area of practice? Or is the information actually you sitting down and saying, wow, let me see how much morbidity is there across the country, and what is the biggest creator of morbidity? How much mortality is there? Is actually maternal mortality the largest problem in the country? Or is it diarrhea of children? Is it pneumonia? And therefore, when the money is being allocated, where should the money be allocated? How big is cancer in the ecosystem? Or is it just a big headline, but actually in terms of mortality and morbidity, it is lower? Now, if you start to understand these ecosystem issues, then you start to ask yourself, what information is needed for that? And how do we allocate the money? What is universal health coverage? What is the service coverage for universal health coverage? What is NHIF paying for? Why is it NHIF is paying for prostate surface antigen, but not paying for pap smear? Why is pap smear considered routine, but prostate surface antigen is considered something, a medical case that needs to be paid for by NHIF? So you need to understand these issues beyond the patients that you see in the Obsgyn clinic. And then you ask yourself, so what is the chain of medical products, vaccines, and technologies? Where do they come from? Who provides for them? If we have scarcity, what do we need to do to go beyond the scarcity? If you don't have oxytocin, what is the chain of getting oxytocin to your clinic? and who is involved in those decisions, who is manufacturing it, how is it purchased, and how does it get to my clinic. Financing, if governments are providing only $40 per person per year, and Europe is providing $4,000 per person per year, why? Is it a fiscal space challenge? Is it a financing challenge? Do I need to go further to understand economics, understand taxation, understand allocation, and what does that have to do with changing the ecosystem of health? Then you have to look into leadership and governance. Who is leading the health sector? Who is governing it? How is that set up? And not only at the Ministry of Health, all the way down to the community level. Who manages the facility? Is it the MedSoup? Is it the CEO where they exist? Or is it the committee or the board, the hospital board? And who selects that board? Why am I not involved in selecting that board? What's my role in looking at that? So you start to look at all these issues, and those are the 6 building blocks. But then even if they are available from a supply side, are they accessible? Are they affordable? Are they of quality? And are they safe? And then eventually you look down there, you say, what research, policy, advocacy work surrounds this ecosystem, and what is the community level of engagement in these 6 building blocks? And then as you layer that, you then ask yourself, really, who is connecting all these dots? And what role would I play within this ecosystem to improve the outcome of the communities I work with? Or am I only concerned about the theater that does gynecological oncology? And therefore, when you don't find adequate anesthesia, your role is only to say this is a really terrible hospital. But if you look at the ecosystem and start to understand further, do you have a role in researching what the problems are? Maybe finding out if you don't have oxytocin, you say, I am actually going to carry out a study to find out the supply of oxytocin and its challenges and barriers. And therefore, now I can actually affect the ecosystem much more upstream. And what is the role in my research informing the policy of how medical products reach where I work? And what is my role in advocating, for example, for health workforce? And that health workforce is not necessarily gynecology. It could be the health workforce of theater nurses, because that's your biggest challenge as you're operating. Or maybe it is advocacy for service delivery and ensuring services go beyond the hospital and they go to the rural areas. And they, maybe you're advocating for outreach. Maybe you're advocating for implementation of the primary care network. And what is the level of involvement of the community? This is the ecosystem, and that's where the career progression, that's where the career choices are, by understanding that the ecosystem is way beyond the clinical discipline. And the clinical discipline is just a part of the service delivery. The clinical specialist is just a part of this health workforce. And then there are all these other building blocks that surround you. And I think as a doctor myself, very early on, and when I was trained in the University of Nairobi, I came out to the view that the doctor was actually the health system. The doctor is the center to the health system, the most important person to the health system. But as I interacted, I discovered that actually the larger ecosystem is so important to enable the doctor to do their work. The nurse, the community health worker who refers the patients, who follows up the pregnant woman to make sure they come for antenatal care, the person who runs the medical supplies agency and decides what is to be purchased, the person who researches and provides information to the government to make its policies, and the person who advocates for areas which are neglected to be invested in. Those people are as important as the clinician, as the clinical skill. So how is this ecosystem? How does it look? It is very complex. I chose this chart that shows a woman and a child because that's kind of where we are. And you can see that the ecosystem, you can classify yourself within the ecosystem where you're working. You can say, I'm actually working in the blue area where it's either public or private health delivery. And that could be the primary care, referral care. I'm working as a health worker in the community. And then you can say, where am I? Am I in the commodity value chain? Am I in charge of making sure oxytocin is available? Either not directly by working in a medical supplies agency, but research and development. What are we doing about, for example, chlorhexidine use for reducing neonatal sepsis? What are we doing about blood that is needed for for mothers who are postpartum hemorrhage? What's our role in that? And is there a career in that area of actually looking at research and development of availability of blood for maternal health? And that could be the supply chain, the commodity supply chain, which is this purple, research and development, manufacturing, procurement, distribution, dispensary, before it even gets to the primary care. Or what is my role in key financing sources? Who finances health services? Who finances maternal health provision? Who finances child health? Who finances oncology? Who finances diabetes and hypertension? And you start to see that the people who finance is, of course, to begin with, the domestic government. The government finances, and if you look at financing right now, which is where financing for maternal health comes in, the government finances only about 35% of all services. But in maternal health, the government may finance only 15% because there are more donors in maternal health. And who are those donors actually who are financing maternal health? Is it, I can mention the largest donors would be the US government through USAID, or through some of their programs in PEPFAR, ending transmission of mother to child, and therefore they have to also provide services around the mother as they reduce mother to child transmission of HIV. They can't then assume the mother will just show up at ANC. So they'll also extend the maternal services, and those are some of the largest donors next to government. Then, of course, you have individuals who have to pay out of their pocket. If somebody is admitted, people have to sell their cow or their chicken or their sheep to come and finance that. So understanding who finances and whether you actually want to be involved in ensuring there is better financing for the areas of passion. If your area of passion is maternal health or maternal oncology, then how do you get involved in ensuring the research, the environment, the advocacy, the policy within that is working? So the domestic government is one of the biggest funders, whether it's national or county. In Kenya now, because this is what we're talking about, I would say that the total amount of money that's provided to the health sector by public services or by taxes is $45 per person. That is barely 5,000 shillings per person, or 6,000. And how do you split that? The counties give about half of that. The national government gives about half of that. But out of what the government gives, a lot of that is donor money. So the money given by maybe some of the donors, not all of them, some of it is in the budget. The US money is never in the budget. It's used through NGOs. So we'll come into NGOs which are implementing. Again, that's also within the ecosystem. But then you have development, the donors themselves who are giving money. And donors could be bilateral, meaning an agreement between Kenya and Netherlands to support provision of maternal health services, or to provide, we've seen private sector, for example, the global private sector, we've seen General Electric trying to support maternal health in northeastern Kenya and Ethiopia. We saw them buying V-scans for ultrasound and trying to support the pathway of referral. We have seen, development banks like World Bank or the African Development Bank agreeing with government to support a particular area of health services, of the health sector. And this is the ecosystem. And donors also include not only bilateral, which is government to government, but also includes multilateral. That means donors that are formed out of government, multiple government efforts. One of those would be the Global Fund to end malaria, TB, and HIV. The Global Fund is many countries, both poor and rich, putting money together based on their affordability, and then creating this Global Fund whose role is then to work with countries that are identified jointly that need to reduce their burden of HIV, TB, or malaria. That is a multilateral donor, and it has a global responsibility. The Global Vaccine Alliance, Gavi, again, is similar to Global Fund, where money is put together by multiple governments through a mechanism of WHO, and then puts this money, says, we want to ensure vaccines are available across the countries that can't afford them. And that's why you see Gavi being involved a lot in the COVID vaccines, but they're also the ones that provide the vaccines for HPV vaccination for free through the extended program of immunization. Again, understanding this ecosystem means, maybe I could extend myself to advocacy for more vaccines for HPV, and how do they reach the schools? Why is it we have only a penetration of about 20% when we should have every adolescent girl having received the vaccines? What's failing? What could be my role? Is it research within that area? Is it ensuring there is more advocacy? What's my role? And then, of course, there are NGOs that then work in between all these agencies. So if you look at the sectors, you can say there is private sector, there is government, and there is NGO. And the NGO, you can call that the third sector. NGOs are funded by either the government themselves, domestic governments, or by these donors, which could be individual philanthropists like Bill Gates or other rich people who say, I want to focus my money on this area, or they could be funded by development banks through direct grants or loans, or they could be funded by multilaterals or other governments. Currently in Uganda, many of our functions on maternal health here, reproductive maternal health, sexual reproductive health and rights are funded by the Dutch government. And those are government decisions to use funding of social sectors as a diplomatic effort. Again, you ask what's in their interest. It's diplomatic efforts. And for some of them, like the US, may be security reasons, and they want to partner with particular governments for purposes of partnering to manage terrorism. So there are many other factors behind this. And also there are areas around partnering to end certain diseases, which could be a risk to their people. You know, HIV, if they don't reduce HIV in Africa, then they could have HIV with their people. If we don't reduce Ebola or COVID, then their people are at risk. That's why the areas of cancer, hypertension, diabetes have very little funding because they're not infectious and they're not a risk to the people from the developed countries. So NGOs then come in between to implement, to assist implementation, advocacy, assisting government with policy. And these NGOs could be local, could be international. You know, Amref Health Africa is international but local, founded in Africa, in Kenya, headquartered in Kenya, but working in 35 countries in Africa, and also running offices in Europe and North America for fundraising. But they all report back to Nairobi. This is where the global headquarters is. Other organizations are based and headquartered in Geneva, in Washington, and they have local NGOs in every country or wherever they are working in Africa or Asia. So those are NGOs, and those will also be in the same ecosystem of solving those building blocks that I talked about, their advocacy, their research. And then, of course, there is regulators. And regulators can start with government regulators like KMPDC, or can go into regulators like Africa CDC, WHO, that do regulation of medications. So this is the ecosystem, ladies and gentlemen. And I think what I would like to do now is stop there. And if there is any particular question, I can answer. But the navigation of this ecosystem starts with your passion, with your curiosity. And once your curiosity starts and you support your curiosity with courage, then you find the networks that support that particular area and move forward with it. Or just stay in your area of practice, but then develop an interest in these areas and make your impact while still doing your clinical work. I'll stop there and hand over back to the moderator.
Thank you very much, Dr. Githinji. That was a very complex topic that you handled very well. Yeah, you actually shed a lot of light and demystified a lot of, you know, all those different sectors that someone can plug in if they have the interest. Yeah. So I'd like I've invited the people to share their questions in the chat box. I can see there is no question posted yet. If you would like to answer verbally, you can actually unmute and ask. And while we wait to do that, I think one of my questions was, though you addressed it in the last sentence, about identifying what are you interested in and trying to research and network in that particular area. Because my main question was, where do you start, you know? Because I think there's a lot of the whole advocacy thing. There's a lot of people on social media saying, I advocate for this, I advocate for that. And then perhaps you're interested in that particular, let's say you're interested in becoming like a policy maker in a certain field, like maternal health. So my question was, once you have the interest, yes, is it about, because some suggestions I usually try to do a course in that, try to do a course in monitoring and evaluation. What would be your advice?
A very good question, actually, Gina, because it's that's the question I get asked often. What course did you do for you to navigate global health? And my answer is, other than my medical degree, none. But along the way, I've done courses or learned from people, not because I wanted to get into the industry, but because I was already in the industry. So would you get into advocacy, policy, without adding any further training to yourself? And the answer is yes. Because actually this area of complexity is about problem solving. It's not about specialization. It's about problem solving. And therefore, if you have, number one, you need to have passion for something. You need to have curiosity for something. You need to start with a question. That's where you start. You start with a question like, why is it that I'm losing so many patients from postpartum hemorrhage? Ask your question and start to wonder, start to be curious. And before you know it, you'll have found yourself in a space you didn't think you would. You'll find yourself in a space of maybe some research, or you'll find yourself in a space of, let me actually advocate for more blood. And therefore, you now start becoming vocal about availability of blood. And the next thing you know, you'll be invited to a meeting where people are talking about maternal mortality, and be invited on a panel to talk about the challenges of access to blood for transfusion. And before you know it, you'll now be in a working group. And before you know it, you'll probably be invited to a policy task force. That's how it develops. So it develops out of interest first. There's no clear pathway. It's first curiosity to solve a problem that's larger than the clinical one. Then after that, curiosity to go deeper into its solutions, being vocal or wanting to get into spaces where that problem can be solved, and then the world finds you, or more or less. So it's not a course you do and say, now because I have this qualification, here it is now to get policy. It's curiosity, interest, and then having that passion to follow up to solve the problem. So it's a problem-solving world. It's not a specialization world. I am actually in this group. I would say in this entire group of people that we are joined here, I'm probably the least learned. So it's not about specialization. It's about interest and curiosity and problem solving.
Wow. That was a great answer. I think doctors are we are goal-oriented people. We believe about specialization coming fast, and I think that could be a roadblock in we have this thing about papers. Do I have these papers? Do I, and I think that was a great point.